Welcome back everyone to my channel Toothwave. Today let's continue the part 2 of the topic fluorides in public health dentistry in perspective of Neet-MDS. So let's begin. Salt fluoridation. Salt fluoridation was first introduced by Dr. Westby, first used in Switzerland in 1955. It was longest and most widespread uses in Switzerland. Methods of addition of fluoride into salt is continuous processing, then batch processing. Now let's know about milk fluoridation. Also, I would like to tell you once again, you can see these highlighted points. You have to remember these highlighted points as these will be helpful for you in your MCQs in your dental pulse. And these are the direct notes which you have to refer. First you will finish these notes which I am teaching you, and then you can directly go and solve the pulse of these particular topics. Now let's come to milk fluoridation. So milk fluoridation was strongly promoted in a Swiss pediatrician by Ziegler. Remember Ziegler. Okay, not in it's just by a Swiss pediatrician. Okay. A first community-based milk fluoridation scheme was introduced in Bulgaria. Okay. Now characteristics. Let's see characteristics. You will have to remember this is a very important chart which you can see on the screen. Okay. You can see here it is sodium fluoride, NaF, stannous fluoride, SnF2 and APF gel. Okay. Guys, I'm telling you again and again that this is a very important chart. You have to remember this chart as it is. Okay. Knudsen technique has 2% recommended concentration, Mueller technique 8% and Broadwell 1.23. And this highlighted points which I have highlighted here, these are asked in various MCQs, and also frequency of application. You will literally find 2 to 3 MCQs in dental pulse on this frequency of application. Then is taste, pigmentation, stability, caries reduction. You have to remember this whole table because it's very important table. Okay. Now note that Bibley in 1942 was the first to demonstrate that the repeated application of sodium or potassium fluoride to teeth of children significantly reduced their caries prevalence. This is also a question in your pulse, so do remember. Okay. And also choking off mechanism takes place after topical application of sodium fluoride. Fluoride varnishes, you have to remember their concentration. Durafet like 2.26%, Fluor Protector 0.7%, Carex 1.8%. Okay. Do remember that Durafet contains 2.26% of sodium fluoride or 22.6 milligram fluoride per ml, that is 22,600 ppm. Okay, 22,600 ppm. You have to remember this point also. Now Fluor Protector, fluoride is 0.7%, 7,000 ppm fluoride. You have to remember this point. And also for Carex, as we have already read here, 1.8%. You have to remember these concentrations. Then comes slow release fluoride containing devices. So first is copolymer membrane device developed in the US, glass device developed in UK, and third is hydroxyapatite Udragate RS100 diffusion controlled F system. This table you can just read, but you just need to know about this table. Okay. Fluoride components in dentifrices. First is stannous fluoride, second is sodium fluoride, third is monofluorophosphate, and fourth is amine fluoride dentifrice. Also, you can note here that the first clinical trial of a fluoride dentifrice was initiated by Bibley in 1942. So here I have already prepared an PPT for you to make it easy. You can take screenshots from my video and just read directly. These are literal direct notes. You just have to read these notes and you can go and solve your pulse. Suppose today I am teaching you this topic of fluorides, so just read this topic from my video and directly go and solve the MCQs, because there is some content in MCQs which I just can't take in lecture, because content is very vast. I am including most important topics in my lecture, and rest which is left you can just go and solve from your pulse. So now let's know about skeletal fluorosis. Skeletal fluorosis causes what? Knock-knee syndrome and then crippling fluorosis. Okay, you can read here what does knock-knee syndrome means and what does crippling fluorosis means. Crippling fluorosis means a problem of spine, and knock-knee syndrome means bending of legs and hands. Now comes the concentration of fluoride in drinking water and its effect on human health. Okay, so if the concentration is less than 0.5 ppm, there will be increased risk of dental caries. Okay, do remember that. Now as you can see here, 0.5 to 1.5 ppm, it promotes dental health, prevents tooth decay. 1.5 to 4 ppm can cause dental fluorosis. 4 to 10 ppm, dental fluorosis plus skeletal fluorosis. Then more than 10 ppm, crippling fluorosis. You have to remember these concentration, what they can cause. Now as you might have heard about defluoridation techniques. So what does defluoridation technique involves? It involves adsorption technique, ion exchange technique, precipitation coagulation technique, and then is precipitation coagulation technique. Now you have to just know about defluoridation techniques which we had read. You can just read their details, because you just don't have to learn these contents like ammonium and this all this. You don't have to know so much detail, but I just want you to read its theory so that you just have an idea. And also do remember this NEERI program. Okay, it is a National Environmental Engineering Research Institute where in Nagpur, which has evolved an economical and simple method of removal of fluoride, which is referred to as Nalgonda technique. Nalgonda technique, do remember, it's very important, guys. Now then is the membrane process technique. What does it include? Reverse osmosis, electrolysis. So here we have finished a topic fluorosis. Now you can go and solve your dental pulse of the topic fluorosis.